Hey friends, welcome back to Gentle Dental. I am Dr. Sarah Chinnery, and today we are going to be spilling the beans on what is actually happening to you at the dentist from the moment you walk in the door to the moment that you leave. We're going to walk through what happens at check-in, the difference between a hygiene visit and a limited exam or like a problem-focused visit, why limited exams does not always mean same-day treatment, and what to expect at a doctor appointment like fillings, crowns, and extractions. My goal with this video is that the next time that you're in the chair, you know exactly what's going on and you feel calm, clear, and in control. Let's start at the front door. When you arrive at the office, you'll usually be greeted by someone at the front desk. Their job is to check you in, confirm your information, handle any forms or updates, and make sure that we know why you're there today. If you're a new patient, this is very, very important. There's usually a stack of medical history questions, consent forms, and sometimes insurance information to get through. So if you are new to the practice, I would highly recommend you coming to your appointment at least 15 minutes early. That way you can be filling out your paperwork before your appointment time, not during it. If paperwork eats 20 minutes of your actual appointment, we aren't always able to do as much as we'd like to just because we have a certain schedule to uphold. If you're an existing patient, check-ins are usually a little bit faster. We'll confirm that your medical history is still accurate, ask about any new medications, allergies, hospitalizations, or diagnosis, and double check what you're scheduled for, whether that's a cleaning, a limited exam, or treatment with the doctor. Once you're checked in, your name gets put on our ready list in the back. That's when one of two people usually come to get you. There are two main pathways your visit can take. So there's a hygiene pathway for cleanings, new patient, comprehensive exams, or regular checkups. And then there's the doctor pathway for limited exams or problem-focused exams or treatment like fillings, crowns, extractions, implants, whatever. If you're scheduled for a comprehensive exam, a new patient first visit, or a periodic exam with a cleaning, that's like your 6-month regular checkup at standard, then most likely you'll be with a hygienist or a hygiene assistant. Will come to get you from the front and call your name. If you're scheduled for a limited exam focused on one specific problem, like my tooth is killing me on the lower right, or therefore a doctor procedure appointment like a filling, crown, extraction, implant, the doctor or dental assistant will bring you back. Either way, their first job is to get you settled and to get some information. Once you're in the room and seated in the chair, we start with the basics. So like the medical history review, we'll ask about medications, allergies, major medical conditions like diabetes, heart conditions, pregnancy, blood thinners, autoimmune, all things that affect how we safely treat you. Even non-dental things matter a lot. For example, certain heart conditions or joint replacements may require antibiotics before we can basically do anything. Blood thinners can affect bleeding if we're doing extractions. Acid reflux can affect your enamel. So all of your medical history, I know we're dentists, but it really does matter. It helps us diagnose everything and help give you guidance on things, especially if you have like dry mouth or things like that. So all very important to remember. Bring them. If you don't remember your stuff, write them down in your notes in your phone, or even if you can bring a printout, we'll be happy to take that as well. The next thing that we'll do is take your vitals. So our office will do the temperature, the blood pressure, and go from there. This isn't us being nosy. This is just to make sure that it's safe to treat you. If we notice even in an exam, if you have high blood pressure, we may note it for you because most of the time, most people aren't checking their blood pressure every day. For some reason, if you were to have high blood pressure and you needed to get that checked out, you would have a heads up. There's a threshold for blood pressure. So sometimes if you're hitting that blood pressure threshold, then we will have to either reschedule you or not be able to treat you and have you go to either a hospital setting or something like that. So it really is important to make sure that your blood pressure is managed for treatment. And the third thing that we'll do after vitals is ask the reason that you're there today and just verifying, are you there for a routine cleaning or checkup? This is like my tooth hurts emergency type of appointment. Then we'll figure out what tooth is hurting you. And then if we're doing a filling, crown, extraction, implant, all the things, then we'll just verify that's what we're doing. From there, your appointment branches out out into the two big categories that we talked about earlier, whether that's the hygiene visit or the doctor side. And so we'll kind of talk about the two different ways. So on the hygiene visit, there's going to be two kind of visits. There's going to be a comprehensive exam. And this is if you're new to the practice or you haven't been seen for a long time. So say it's been 3 or 5 years, then it'll be technically a new exam. There's a lot of things that can change by then. So we'll consider you a new patient technically. And then the periodic exam is if you're an established patient coming every 6 months or 3 months, depending on what your periodontal health is. And so those are the main thing for hygiene. Most of the time, again, if you have periodontal disease, you have insurance requires us to send that to them and pre-authorize it before we can treat you. So if you do have periodontal disease, a lot of times we just do the exam and take the x-rays and diagnose all the cavities and all of that, and then see you when the insurance has approved it. Also noting, if you do have periodontal disease, then a lot of times we'll do the cleaning and then reevaluate to make sure we didn't miss any cavities underneath the parts that were covered. The next thing that we'll do is radiographs or x-rays that most people know it as. And most of the time it's either your hygienist or hygiene assistant will start taking your x-rays. This will most likely be like 4 bite wings, which is the side views where we can see in between your teeth for cavities and bone loss. And then the PAs, periapical x-rays that can see the roots. So a lot of times we'll take like some in the front. If we notice a tooth that's in pain or whatever, we'll take them in the back. And then we always take a pano x-ray, which gives us the full view. It's that thing that goes all the way around your head. So those are usually the main things that we do. And like I mentioned earlier, all these x-rays are very crucial for us to check the big picture view of your jaw, sinuses, wisdom teeth, cavities hidden in between your teeth, bone levels around your teeth for gum disease, infections at the roots, problems with old fillings or crowns. So they're so helpful for us to identify what's going on. I know sometimes people want us to take the pictures from another office, and I will say, even if we don't charge you, we basically have to take them because it is so difficult getting a printed off sheet of x-rays and trying to identify what's going on. So no, we're not trying to just take them for fun. We usually just can't see what's going on. So just know, be patient with us that you may have to get them over again. And most of the time we won't charge you if we know that you've just gotten them recently done. So anyways, enough on that. The next thing that the hygienist will do is periodontal probing, which is the gum measurements. Typically, like when you become an adult, sometimes a little bit younger, depending on your health history and all of that, then your hygienist will measure your gums with a small ruler-like instrument. You might hear numbers calling out 232, 434, and then they might say bleeding, all of that. And so those are the probing depths, and it tells us how deep your pockets are around your teeth, whether your gums are healthy, inflamed, or showing signs of gum disease, whether you need a regular cleaning every 6 months or a deeper cleaning, more involved, getting numb, and that's called scaling and root planning. And then at that point, you would be on the periodontal maintenance status, not the regular cleaning. This is how we decide what kind of cleaning you actually need. So a quick polish might feel nice, but if there's deeper buildup underneath the gums, we're not doing you any favors by ignoring it. I know that's exactly what most people want, but it's really giving you a disservice if we're not doing our job. The cleaning itself, again, is based on what we see. Your cleaning might include removing plaque and tartar above and below the gum line, using hand instruments or an ultrasonic scaler, which is kind of like the power washer if you've ever had that done, and then polishing to smooth the surfaces, flossing, and showing you any areas to pay extra attention to while you're at home. Because again, we just do a little bit of every year thing, and 90% or more is what you do every day. Mainly the hygienist for education purposes is like the biggest thing for you. They're going to show you tips, tools, and techniques tailored to your mouth. Once the hygienist has gathered all the information, x-rays, gum measurements, any notes of concern that you have, then the doctor will come in and do their exam. So typically I'll start with an oral cancer screening. So I'll feel on the outside and then I'll look inside. I'll check your bite and measure basically how your teeth sit together, your overjet, overbite, all those fun things. And then I'll look again at your tissues, making sure all of that looks healthy. And then from that, we'll basically check all of your old fillings and crowns that you have done, go over what the hygienist has found, check about your gum and bone levels to see what kind of cleaning that you need. And then we'll talk through any symptoms symptoms or do any testing that we need to if you have a specific tooth that's hurting. If you're grinding, we'll recommend a night guard, or if you're a kid, maybe we'll talk to you about going to get a sleep study for possibly sleep apnea. So after I get all that data, I'll usually sit your chair up and we'll talk about what I found, what's urgent, what's on our radar if we're monitoring anything, what treatment is actually recommended, and how we might phase it if there's a lot going on, and just make sure that we have everything, we're on the same page. Then your hygienist, if they need to clean or not, they will, and then they'll get you scheduled for the treatment that you need. Sometimes that is the front desk thing, and sometimes that's the back thing. So it just depends on what your office does. So that's kind of the hygiene visit in a nutshell. We're going to talk next about the doctor side. So let's talk about the limited exam. And sometimes that's called like an emergency exam or problem-focused exam. This is when you call and say, this one tooth is killing me, my face is swollen, my filling broke, my crown came off. Basically anything that you're calling because you have a problem. And the limited exam is designed to focus on one problem. We're zooming in, not doing the whole mouth tour, okay? So what happens at a limited exam? It usually looks like this. You check in, same as before. Assistant brings you back, takes your vitals, confirms your medical history. You explain the problem, where it hurts, what it feels like, how long it's been going on for. We take targeted x-rays of that area, and then the doctor will come in, do some tests depending on the area in the tooth and what we see on the x-ray. Well, sometimes we'll do like, if we call it endo testing, so we're seeing if the tooth is vital. So we'll do like cold testing, tapping on your tooth, checking your bite, examining your gums, checking for cracks, feeling around. Those are a lot of times the checks that we have to do before we can diagnose what is going on with that tooth. We're trying to figure out, is it a nerve problem? Is it a gum problem? Is it a crack problem? Is it a sinus issue mimicking tooth pain? That's really common, especially when it's cold out. Your roots of your molars are typically lining or really close to your sinuses. So if you ever feel sinus pressure and you're feeling tooth pain, sometimes it's a sinus infection and not a dental infection. So just know that that is a very common thing. I love those appointments, honestly, because then I know it's not a tooth problem and it's just a simple fix of antibiotics or something like that with your primary care doctor. But it makes me happy knowing that it's not a tooth issue versus something that can be fixed with a round of antibiotics. So all to say, don't feel embarrassed, because I know a lot of people are when they're like, I'm at the wrong doctor. I'm like, I'm so glad you are, because we hate having people in pain. We're just trying to figure out if it's an infection that needs urgent attention. I feel like limited exams are very, very misunderstood. And I don't think that when you're calling, we're not saying, okay, we're scheduling you for a limited exam. Typically on the schedule, we have one column for the doctor that is for major treatment. So like fillings, crowns, extractions, things that are already treatment planned. The second column is for limited exams. And so we don't usually have enough time, or we don't plan on having enough time to do treatment on you. Typically, it's more just a diagnosing triage thing. And so I think that is a very big misconception. And so again, a limited exam is about diagnosing the problem, not always fixing it on the spot. In a perfect world, we would have unlimited time and extra rooms and could jump straight in from diagnosis into treatment every time. But in reality, we usually have hour max for limited exams. And so we don't want to feel rushed, and we don't want to not treat you the best way that we can. And so just know, if you're coming in for a limited exam, that does not mean that we can treat you that same day. We wish we could. We really do. But that's just not how the scheduling system works. Because on top of the second column, so there's 2 patients usually at all times. The third column is usually hygiene, and this is just for like a one doctor shop. Sometimes they have more if they have lots of assistants and things like that. But like for me, I have a main column for procedures, a second column for limiteds, and then the third column is for hygiene. So my hygienist has a full column. So I'm doing exams and looking at x-rays and doing that as well on top of 2 other patients. So just know that we are trying our best. We're just spread thin. If we take 30 to 40 minutes of the hour exam to gather health history, take x-rays, do tests, and talk through options, that leaves us in like the hour means, the room has to be cleaned. So it's really like a 50-minute thing, because it takes about 10 minutes to change the rooms over. So just know that, again, we really try our best, but we can't expect treatment if we don't have the time. Because then if we run into another appointment time, then we're not respecting their time, and as well as then we're late the rest of the day. So I promise you, we want want to respect your time and the time of the person scheduled after you. So just please be kind to us even I know when you're in dental pain, it's not ideal and we don't want you to be in dental pain. But again, it's just how the scheduling thing works. We just typically don't have time to do everything that we'd like to. I never want people to be blindsided if they come in for a toothache appointment and we spend most of the time figuring out what's going on and that we can't fix what's going on that same day. We really need to make sure that the diagnosis is correct and then the treatment comes next. I know that we can need to get you on an antibiotic or we can send you to a specialist or something that same day, then we totally will. So let's talk about the third category, the doctor appointments, where treatment is actually planned. So that's the first column. And things are like fillings, crowns, extractions, implants. Said it a zillion times already. What we do. So just like before, the assistant will check your medical history, take your vitals, confirm what we're doing, what tooth and area we're working on, and then they'll come get me and we'll get you numb. First, as long as you don't have alpha gal, we'll do topical jelly to make sure that the injection doesn't feel as uncomfortable, and then the local anesthetic will be given after that, and it usually takes about 6 minutes to kick in depending on what type of anesthetic that you use. During that time, the assistant usually will be in the back unwrapping things to set things up, and the goal for doing the lower jaw, you'll feel basically all the way to the midline and then half of your tongue as well, and then on the uppers it doesn't feel as pronounced just because we're numbing just the upper area. So there's different blocks that we can do, and sometimes we can just do local infiltration. So just depends on what area that we're working on. I will say none of the shots are fun, so I try and go as slow as I can just so that it's not as stingy, but again, it's not fun. So I'm sorry. Things that you can do is like bring headphones, bring something to like squeeze or pinch or anything like that to kind of help redirect your pain and get you kind of zoned out so that you don't have to like visualize what's going on. And the other important thing I want to say, if you're ever feeling something, whether you feel like you're not numb enough, just say something. We always say raise your left hand if you're feeling anything or if you have any questions, and we really do mean it. We always stop what we're doing and ask what's going on. Sometimes people's nerves are different, so sometimes our injections are needing to go in different locations. You're not being difficult. We don't care. We just want you comfortable. Like, it really doesn't matter to us. We feel bad whenever we're making you uncomfortable, so just tell us. For a filling appointment, the appointment might look like you're going to be numbed. We'll isolate the tooth, whether that's sometimes with a rubber dam or isovac or isolite, something like the rubber things. Then we'll clean out the cavity. So we'll use a handpiece and you'll just feel like a lot of water and vibration. And that is to remove the decay, the cavity part of the tooth. We place the filling materials in. Sometimes we have to use bands and things like that and cure it. I use a Garrison system. There is like a forceps that kind of looks like something that you would extract a tooth with. And I have had a few patients that after I've done the filling and they were like, I thought you were extracting my tooth. And I was like, why were you so calm? Like, that's crazy. I was like, I would hope that you would say something, like if you thought that I was actually taking your tooth out, which I had done extractions on them before, so it wasn't out of the question. I cannot believe how calm you were. She's like, yeah, I just thought you were taking my tooth out. And I was like, okay, that's terrible. So it does look crazy, but it basically just like holds the band so that your anatomy is the best that it can be. There's so many different tools. So if you have questions or if you're curious, because sometimes those things look really scary, so just ask before you start, and you can ask the assistant even, and they'll be happy to show you. After the filling is placed, we'll shape and polish and check your bite. After, we'll get everything out, and I say we'll bite on some bubblegum paper for kids, or just articulating paper is what it's called, and it basically shows up on the tooth where you're hitting. So we're allowed to be able to see if you're hitting on the filling, then we'll adjust that and then check your bite until we don't see anymore. You'll leave with a tooth that's been cleaned out, sealed up, and restored, and your numbness will last for a couple hours after. If your bite ever feels off after you've had a filling done, please call the office and let us know, because if you leave that for a long time, you can bruise the ligament around your tooth and it can cause a toothache. So just know, especially if it was a deep filling, if it feels funny once the numbness wears off, please let us know. For a crown, which is kind of like a cap covering the tooth, it's a little bit more involved. After we numb the area, we'll remove the decay, shape the tooth so that the crown can fit. We take a scan of your mouth, and then we'll take a temporary crown. Some offices have same-day crowns that you'll leave with, but for a lot of offices, it'll be a temporary, and you'll come back for a second appointment to have the permanent crown cemented. And then for an extraction, after numbing, we basically feel around your gums to make sure that you're feeling nice and numb, and then we'll remove it. You'll feel pressure. You won't feel any sharpness. Sometimes if you have a really large infection, you'll still feel a lot of pressure, but the sharpness we can take away, the pressure we can't. Sometimes we'll have to add stitches to it, and a lot of times that we'll use ones that are dissolvable in within 7 to 10 days. So it just depends again on the extraction and how it goes. Make sure after the extraction, you'll get very specific aftercare instructions like no smoking, no straws, be careful with spitting, what to eat, what to avoid, how to keep the area clean. You'll probably leave with some gauze in your mouth to help with the blood clotting and a plan for pain control and follow-up. If you're getting an implant, for those that do that, after you get numb, they'll place like a small titanium post in the bone where the tooth used to be. They'll allow time for healing and integration, and then later place a crown on top of that implant. So I want to touch on one more thing. Again, scheduling and timing. I know I've mentioned this earlier, but our days are often booked in specific times blocks. So like you'll have an hour for hygiene visits, depending on the office. Sometimes you'll have 30 minutes, sometimes you'll have an hour for a limited exam, and then you'll have longer blocks for bigger procedures. So again, if we spend 40 minutes diagnosing a complex problem during a limited exam, we simply do not have enough time left in our slot to safely do something and stay on time for the next patient. That doesn't mean that we don't care. It means we care enough to not rush something that should be done carefully. And it makes me sad when I have to send you away, but a lot of times we only have a certain amount of seats, certain amount of chairs, and we just simply don't have time to do what we need to. So again, if you're new to a practice, come 15 minutes early so paperwork does not chew up into any of your treatment time. And if you know you have a lot going on, don't be surprised if we need more than one visit to collect information, talk through options, actually do treatment. If you ever have sat in the chair thinking, what are they doing now? Why does this appointment feel so short? Why can't they just fix it today? I hope this video helps connect some of the dots, from check-in to vitals to x-rays to gum measurements to exams to treatment. There's a lot going on behind the scenes to keep you safe, informed, and respected. And you are always allowed to ask, what are you doing now? How long will this part take? Will we be doing treatment today, or is today just for the diagnosis? A good dental team should be happy to answer those questions. If this video helped you understand dental visits a little better, or if you have more questions about how appointments work, let me know in the comments. And if you're someone who dreads the dentist, you're not alone and you're not too much. You just deserve explanations and a team that listens. Don't forget to like, subscribe, and share this with someone who's nervous about their upcoming appointment. Thanks for watching Gentle Dental, and I hope this episode makes you feel calm, clear, and confident. I'll see you next time.